Hey there, bony lads and lasses. Welcome to Pathway Medical. Today, we're diving deep into the fascinating world of skull anatomy. But before we get started, if you haven't already, I recommend checking out my previous video on the overview of the skeleton. It will provide a great foundation for understanding the skeletal system. Now let's dive into it. The human skull is a complex structure located at the top of the body, surrounding and protecting the brain. It's made up of 22 bones, which we can categorize into two main groups: 8 cranial bones and 14 facial bones. These bones are joined together by sutures. Sutures are immovable joints that fuse as we age. The primary sutures in the skull include the coronal suture, a joint separating the frontal bone from the parietal bones; the sagittal suture, a joint between the two parietal bones of the skull; the lambdoid suture. It separates the occipital bone from the parietal bones; and lastly, the squamous suture. It separates the parietal and temporal bones. Now let's talk about the cranial bones. They include the frontal bone, 2 parietal bones, 2 temporal bones, occipital bone, sphenoid bone, and the ethmoid bone. The frontal bone. It is located at the anterosuperior aspect of the cranium. It consists of 4 parts: squamous, 2 orbital parts, and nasal. The squamous part is the largest, shaping the forehead's distinctive curve and housing the frontal sinuses. It contributes to the formation of the supraorbital margin and contains the supraorbital notch, which acts as a channel for the supraorbital nerve and blood vessels to pass through. The middle part, just between the eyebrows, is the glabella. This is an important part used in the glabellar reflex. The orbital part. It contributes to the supraorbital margin. The nasal part. It's the part that protrudes inferiorly. Some other parts worth mentioning are the zygomatic process of the frontal bone, and inside, the anterior cranial fossa. The clinical relevance is the fracture of the frontal sinuses, mostly from motor vehicle accidents. The parietal bones. These are 2 bones that protect the brain. The occipital bone. It's the bone that forms the major part of the posterior and base of the skull. There are 3 parts to the occipital bone: squamous, condylar, and basilar. The squamous part of the occipital bone is the largest and most posterior portion. It forms the posterior part of the foramen magnum. The external surface is marked by 4 bony ridges from the external occipital protuberance, known as the neutral lines. These include the superior neutral line, median neutral line, and inferior neutral line. There is the presence of the supreme neutral line, which is hardly seen on the cadavers. The condylar part of the occipital bone forms the lateral walls of the foramen magnum. It is composed of 2 occipital condyles. Posterior to the condyles lies a depression called the condylar fossa. This fossa contains the condylar canal, which may carry the occipital emissary veins. The inner side of the condyle base contains the hypoglossal canal, where the hypoglossal nerve exits and a branch of the ascending pharyngeal artery enters. The jugular foramen lies lateral to the hypoglossal canal. It is located at the junction of the occipital bone and the petrous portion of the temporal bone. This is where the internal jugular vein exits from. The basilar region of the occipital bone forms the anterior part of the foramen magnum. It articulates with the temporal and sphenoid bones. The internal surface is marked by a broad, shallow groove called the clivus, which supports the medulla oblongata. Structures that pass through the foramen magnum include the medulla oblongata, accessory nerves, vertebral arteries, anterior and posterior spinal arteries, alar ligaments, and the meninges. The occipital bone as a whole houses the posterior cranial fossa. The temporal bones. They comprise of the squamous part and the petrous part. The squamous part has the zygomatic process, which contributes to the zygomatic arch. It houses the external auditory meatus, the ear, the mastoid process, styloid process, the stylomastoid foramen, which allows passageway of the facial nerve, and the stylomastoid artery, and the mandibular fossa, which contributes to the formation of the temporomandibular joint. The petrous part of the temporal bone houses the internal auditory meatus, which allows passageway for the vestibular cochlear nerve. There is also the jugular foramen, as mentioned earlier, is on the junction between the temporal bone and occipital bone. This is where the internal jugular vein exits from. The sphenoid bone. It consists of a body, greater wings, lesser wings, and two pterygoid processes. The body contains the sella turcica, which consists of dorsum sellae posteriorly, tuberculum sellae anteriorly, and the hypophyseal fossa, where the pituitary gland rests. The sella turcica is surrounded by the anterior and posterior clinoid processes. The anterior clinoid processes arise from the sphenoidal lesser wings, while the posterior clinoid processes are the superolateral projections of the dorsum sellae. The greater wing of the sphenoid bone extends from the sphenoid body in a lateral, superior, and posterior direction. There are three foramina present in the greater wing. The foramen rotundum, which contains the maxillary nerve. Foramen oval, which contains the mandibular nerve. Accessory meningeal artery, lesser petrosal nerve, and emissary veins. Lastly, the foramen spinosum, which has the middle meningeal artery, middle meningeal vein, and meningeal branch of mandibular nerve. The lesser wing of the sphenoid bone arises from the anterior aspect of the sphenoid body in a superolateral direction. It separates the anterior cranial fossa from the middle cranial fossa. There is a gap between the lesser and greater wings of the sphenoid called the superior orbital fissure. It allows the passageway of the oculomotor nerve, trochlear nerve, ophthalmic nerve, abducens nerve, ophthalmic veins, and sympathetic fibers from the cavernous plexus. There is also the presence of the optic canal in the sphenoid bone, where the optic nerve, ophthalmic artery, meningeal sheaths, and sympathetic nerve fibers pass. The pterygoid process descends inferiorly from the point of junction between the sphenoid body and the greater wing. It consists of two parts, medial and lateral. The other foramina are carotid canal, where the internal carotid artery and its internal carotid, nervus, plexus pass. Foramen lacerum, where the greater petrosal nerve and the deep petrosal nerve pass. The sphenoid bone forms the most part of the middle cranial fossa. The ethmoid bone. It is situated at the roof of the nasal cavity and between the two orbital cavities. It is made up of three parts: the cribriform plate, the perpendicular plate, and the ethmoidal labyrinth. The cribriform plate forms the roof of the nasal cavity. It is pierced by numerous olfactory nerve fibers, which gives it a sieve-like structure. The foramina that the olfactory nerves pass through are called the olfactory foramina. Projecting superiorly from the cribriform plate is the crista galli, which provides an attachment point for the falx cerebri, which is a sheet of dura mater that separates the two cerebral hemispheres of the brain. Another projection of bone descends from the cribriform plate, the perpendicular plate. It forms the superior two-thirds of the nasal septum. Lastly, the ethmoid bone contains two ethmoidal labyrinths. These are large masses located at either side of the perpendicular plate, which contain the ethmoidal air sinuses. Two sheets of bone form each labyrinth, the orbital plate and the medial sheet. The superior nasal concha is located on the medial sheet. Now let's talk about the facial bones. They include the zygomatic bone, the maxillary bone, the mandibular bone, part of the frontal bone, and the nasal bones. The zygomatic bone. The zygomatic bone is an irregularly shaped bone. It is often referred to as the cheekbone. The zygomatic bone also contributes to the formation of the zygomatic arch. It houses the zygomaticofacial foramen, which transmits the zygomaticofacial nerve, artery, and vein between the orbit and the face. It also houses the zygomaticotemporal foramen, which transmits the zygomaticotemporal nerve from the orbit to the temporal fossa. There is the presence of the maxillary process of zygomatic bone and the temporal process of zygomatic bone. The second most common area of fracture in the face is the fracture of the zygomatic bone, especially of the left frontal process. This kind of injury often happens during a car accident or due to being punched in the face. The maxillary bone. The maxilla is also known as the upper jaw. It has a few projections: the frontal process, zygomatic process, palatine process, and the alveolar process. It contributes to the formation of the infraorbital margin. It houses the infraorbital foramen, where the infraorbital nerve and vessels pass. It also forms the alveolar margin. It also has the inferior orbital fissure. It allows the passageway of the infraorbital nerve, artery, and vein, inferior ophthalmic vein, zygomatic nerve, orbital branches of the pharyngeal nerve, and maxillary nerve. It also has the inferior and middle nasal concha. Lastly, it contains the incisive fossa, which carries the sphenopalatine artery and the nasopalatine nerve. There is a small bone called the vomer bone. It forms the lower 2/3 of the nasal septum, the mandibular bone. It's the largest and strongest bone of the face. It forms the lower jaw. It also articulates on either side with the temporal bone, forming the temporomandibular joint. The mandible consists of a horizontal body, anteriorly, and 2 vertical rami, posteriorly. The key features include the mandibular condyles, which articulate with the temporal bone to form the temporomandibular joint, the mandibular notch, the coronoid process, which allows attachment of the masseter and temporalis muscles, mandibular angle, the mental foramen, which allows for the passageway of the mental artery and vein, the mandibular foramen, where the inferior alveolar nerve, inferior alveolar artery, and the inferior alveolar vein pass. It also has the alveolar process of mandible and the alveolar margin. There is a small suture-like line called the symphysis menti, the palatine bone. It has the horizontal plate and perpendicular plates. There are some important structures in the skull you should know. 1. The pterion. This is regarded as the weakest point of the skull. The anterior division of the middle meningeal artery runs underneath the pterion. Any injury at this point may rupture the artery and cause harm. 2. The asterion. It is used as a surface landmark for the anthropological measurement of the skull. 3. The bregma, the point of junction of the coronal and sagittal sutures of the skull. Lastly, the lambda, the point where the sagittal suture and the lambdoid suture come together. Well done! Now you know the basic structure of the skull. Let's now talk about the differences between the male and female skull. The male skull is thicker and heavier, compared to the female skull, which is thinner and lighter. The mastoid process of the male skull is more prominent than the female skull, while the frontal and parietal tubers are less prominent in the male skull but more prominent in the female skull. The male skull has more cranial capacity, while the female skull has less. Let's wrap things up by taking a closer look at the differences between the adult skull and the infant skull. The infant skull has fontanelles. These are spaces where the sutures have not yet joined, covered by a membrane. There are 4 fontanelles: anterior, posterior, sphenoidal, which is paired, and mastoid, which is also paired. The frontal air sinus does not exist at birth, and the maxillary air sinus is rudimentary at birth. However, in the adult, both are present. The mastoid and styloid processes are underdeveloped as their ossification starts after birth. The infant skull also has an extra suture compared to the adult. This is the metopic suture. The symphysis menti is not fused compared to the adult, which is fused. The facial features of the infant are smaller compared to the adult. The angle of the mandible is larger in the infant, while in the adult it is smaller and sharper. Lastly, the coronoid process level of the infant mandible is above the condylar process level, while in adults it is the condylar process level, which is above the coronoid process level. That's it for today's deep dive into the anatomy of the skull. If you found this video helpful, make sure to like, subscribe, and hit the notification bell so you don't miss any future videos. Feel free to leave any questions or topics you'd like us to explore in the comments below. Thank you for joining us, and we'll see you in the next video.